right, Miss Jane Smith is due for Coumadin 10 milligrams, Lopressa 25 milligrams, Digoxin 0.25 milligrams, doxycycline 100 milligrams, and her Nitroderm patch 0.3 milligrams. They're due at 8 o'clock. It is now 8 o'clock. So I got the right patient, got the right time, and I have her Coumadin 10 milligrams. I have her Lopressa. This is a 50 milligram tablet. Will have to be cut in half to give her a 25 milligram. I have her doxycycline, which is 100 milligrams. And I have her Digoxin, which is 25 milligrams. And her Nitroderm patch, intact, not expired. Medication cup. All right. All of my items.
Come in.
Hi, good morning. How are you doing today?
I'm good, and you?
I'm great. My name is Candace. I'm just going to open up your chart. How are you feeling this morning?
I'm feeling good.
Can you confirm your name and your date of birth for me?
I am Jane Smith, born January 1st, 1958.
Okay. Miss Smith, are you allergic to any medications?
Yes. Penicillin and morphine.
Okay, correct. How are you feeling this morning?
I'm feeling good.
All right. All right. Hand washed. Checking the medications again. I got computer pull up the MAR system. I have Digoxin 0.25. I have Coumadin 10 milligrams. I have my Nitroderm patch 0.3. I have my Lopressa. This is 50 milligrams. I'm going to cut this in half. That's 25 milligrams now. I have my doxycycline, which is 100. So you've been feeling good this morning?
Yes.
All right. Before I administer you your morning medications, I do have to get your blood pressure, and I need to take your... I need to check your pulse.
Okay.
Close up the curtains for privacy. And do you mind? Let me scan your ID badge. All right. Your name, date of birth. Everything matches up. Do you prefer, you want me to do it on this right arm? All right. I'm going to have you just relax. Oh, your blood pressure is excellent this morning. 110/70. Have they gave you your morning breakfast yet?
Yes.
And I'm gonna have you just look. You're gonna stay laying back for me. I'm gonna just listen to your heart for 1 minute. All right, and your pulse is great. We have a pulse of 70. I'm going to document that into your chart. Give me just a moment. All right. So, hands. All right, Miss Smith, do you want all of your pills in one container, or would you like them do you want each one of them separately, or do you want them all together?
All together.
All right, so this morning you're going to be getting your Coumadin. Your Coumadin is used to treat blood clots. It is the action, it inhibits the synthesis of vitamin K. Side effects, you can have easily bruising, and you can have excessive bleeding. If you notice any bruises that you've gotten or any abnormal bleeding, whether it's gum or nose, you're going to notify the provider right away. We also have for you digoxin today. You're going to take 0.25. Your pulse was within normal range, so you're able to get your medication today. The purpose of your digoxin is to help treat irregular heartbeats, and the action of it is to increase the myocardial contraction. Your side effects can be confusion, dizziness, fatigue. If you have any of those symptoms, you're going to give us a call and let us know, because those are common side effects. You're also going to get your Lopressa 25 milligrams today, and that is just to help with your hypertension and your chest pain, angina. And the action of your Lopressa, it is a beta stimulator of beta 1. It is a myocardial androgenetic recessor. So it's going to help you with the chest pains that you're having. The most common side effects from this medication is dizziness as well, confusion, depression, and trouble sleeping. So if you develop any of those symptoms, you're going to give us a call, let us know. We'll do whatever we can to help treat those symptoms that you're having. The doctor also ordered doxycycline for you, so you'll get that today. That's going to help treat the urinary tract infection that you have, which is a bacteria infection. And the purpose of the action for the doxycycline, it inhibits protein synthesis by binding to the 30S ribosome subunits. You may have diarrhea, difficulty breathing, difficulty swallowing, or headaches, hives, or esophageal ulcers. If you get to a point where you feel like you're having difficulty swallowing, that is urgent. You want to let us know. You also have your Nitroderm patch. This is going to help with the chest pains you're having from the angina pectoris. So we'll apply this patch to your arm. It can be worn 10 to 12 hours a day. And you'll go at nighttime 10 to 12 hours with it off. So we'll apply your patch today. And the purpose, again, it prevents attacks of chest pains. The action is it releases, it relaxes and widens the blood vessels so that the contraction, so that the blood can flow through the muscles of the heart easily. And side effects can be flushing, where you're sweating. You can have some nausea. You can have some headaches and dizziness. So I know a lot of these medications have pretty much the same common side effects. If any of them, typically after taking these medications for a while, side effects do lessen and get better. If you get to a point where they're continuing or not easing up, you're going to give us a call. Do you have any questions about your medications today?
No.
All right. So, wash hands. For hand hygiene again. Would you like all of your medications at one time, or would you like them? Do you want me to individually give them to you?
All at once.
All right. So we're going to give you Coumadin, 10 milligrams. Scan the barcode. These are 5, so we're going to give 2. That makes us a 10 milligram. We're going to take doxycycline, 100 milligrams. Scan. For your Lopressa, this is 25. This is a 50 milligram. You're only supposed to take 25. We're going to use a pill cutter, slice that in half. And then you'll take this half today, the other half tomorrow. Your digoxin, that helps with your heart rhythm, 0.25 milligrams. 1 whole pill. Give you all of these. You're on a low diet, low sodium diet. None of these medications interact with your allergies of the penicillin or the morphine. So here's your pills. Here's your water. All right, well, thank you. Now, last but not least, we're gonna apply your patch. Again, that's just gonna help with the chest pains. I am going to apply it to your right arm, if that is okay with you. Is that fine with you?
Yes.
All right. We're gonna first just wipe off the your arm with just a little water. We're not gonna put any lotion on there because we want it to stick. We'll clean that area good. We'll let it dry completely. Then we open up the package. I'm gonna apply it. Make sure all ends are on. I'm gonna put the date, the time, my initials. Press it down for 30 seconds. Make sure it's on there, nice and firm. There. All right. All right, do you have any questions for me?
No.
All right, well, I will be back in about an hour to check on you to see how things are going. Here's your call button. You press this button if you need the nurse. This button is for your TV. You can cut on the TV, watch you some TV. And again, if you need me, press the nurse button. Pull back up the side rails. I'm just going to document her vital signs and the EMR. Medications were all given. Patient was doing fine. Blood pressure was great. Pulse was normal. All right. You sure anything else you need before I exit out of your room?
No.
All right. Hand hygiene. Wash my hands. Throw away my trash. Open up the door. All right. I'll be back later to check on you.
Okay.